Goni cervical flexion. Position the patient in sitting with the thoracic and lumbar spine well supported by the back of a chair. Position the cervical spine in 0 degrees of rotation and lateral flexion. If necessary, the patient can hold a tongue depressor between the teeth for reference. In patient-appropriate language, ask the patient to flex the neck. Assess the trunk for flexion of the thoracic and lumbar spine. Put one hand on the back of the subject's head and with the other hand hold the subject's chin. Push gently but firmly on the back of the patient's head to move the head anteriorly. Pull the subject's chin in towards the chest to move the subject through flexion range of motion. As you observe the trunk to prevent forward flexion of the thoracic and lumbar spine, the end of cervical flexion range of motion occurs when resistance is felt and additional motion causes the trunk to flex. Assess the end feel, which is firm because of stretching of the posterior ligaments, posterior fibers of the annulus fibrosus, and the facet joint capsules. Also because of impaction of the submandibular tissues against the throat and passive tension of the iliocostalis cervicis, longissimus capitis, longissimus cervicis, and various other muscles. Refer to your text for a complete list. Now you're ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the external auditory meatus. Align the stationary arm so that it is either perpendicular or parallel to the ground. Align the movable arm with the base of the nares. If a tongue depressor is used, align the arm parallel to the longitudinal axis of the tongue depressor. Ask the patient to perform cervical flexion as previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the trunk. Read the degrees of motion on the goniometer and then ask the patient to return the head to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion according to the American Association of Orthopedic Surgeons is 45 degrees.